Welcome, Natalie. Thank you for joining us for International Reflux Day. Could I start by asking you to tell us about the organisation that you work for, in fact, founded, and where your experience of reflux in children comes from?
Hi, Ange, and hi, everyone. Thanks for welcoming me here today. So my name's Natalie Morris. I'm a speech and language therapist by background, but I founded the Feeding Trust, which is the UK's only organisation that is supporting children with paediatric feeding disorders. So we support the children and the parents and families and the people around them, so their schools and their other health professionals, with the treatment of their child's feeding disorder.
Mm-hmm. And children with reflux, where
does that come in?
Yeah.
So paediatric feeding disorders are sort of a relatively unheard of term, and it's quite a new sort of diagnostic term. But basically, it describes a category of children and young people who have got what I would describe as developmental feeding difficulties. So it's children who've had difficulties with learning to eat due to sort of medical or developmental or sort of nutritional reasons. So a lot of our children have got things like sort of cerebral palsy or Down syndrome or neuro-diverse, like sort of children, autistic children. A lot of our children have got allergies. So we have lots and lots of children who have got lots of different complex sort of medical backgrounds that have impacted on their ability to learn to eat. And what we've found, we've done some research recently at the Feeding Trust, and we've actually looked at what we would call the comorbidities associated with paediatric feeding disorders. So commonly co-occurring conditions that we see with our children who are coming through. And actually 57% of our children actually do have a significant history of reflux. And in a lot of our children, you can actually see directly the impact that reflux has had on their ability to learn to eat in the first place.
So how early can problems start then?
Well, I mean, reflux is a really quite a common issue. A lot of babies, have reflux on their sort of pure milk diet, and it's not unusual in young babies to have a bit of reflux. And for the vast majority of those children, they might need a bit of Gaviscon or something like that. They go to the GP and they grow out of the difficulties, especially as they wean and they get onto more solid food, and it sort of stays down a bit better. But for some of our children, that reflux really it doesn't resolve, and actually it's really quite severe. So what you see is some really quite significant vomiting and reflux that really does interfere with that child or that baby's and young baby's ability to acquire the skills to learn to eat, and they develop quite a problematic relationship with food right from an early on, because actually what they begin to learn is eating or drinking makes me sick, so therefore it's something that I avoid doing, and I find I find difficult.
So it's presumably for some parents, it may feel like a child's been sort of naughty or stubborn with
I think sometimes people can see it like that from the outside. I think parents inherently know their child is not being naughty or stubborn. But I think maybe for people on the outside looking in, it might be that they'll, because you don't always see, from the outside, you won't always see the child, how frequently that child is vomiting, or you won't see the fact that child has got a very, very significant sort of memory of, oh, I had this before and it made me sick, so I don't want to have that again. I mean, we've all had that, haven't we? We've had the experience where something's made us sick and afterwards we're like, oh, I don't want to eat that again. But, obviously babies and young children and sort of have quite limited diets to start with, because they go from just milk and then they're sort of weaned, and you only have a few foods to start with. And if you learn quite early on that can make you sick, children they learn to avoid things that hurt them. If something hurts me and I think it's going to hurt me, I'm going to avoid doing it. And so what I'll do is, I'll turn away, I'll push away. I don't want that. And it causes, it can cause real problems with that child's ability to to actually acquire the skills they need to learn to eat. And quite often, when babies have got quite severe reflux, they're advised, quite sensibly, by the medical professionals to wean early. So typically you sort of wean a baby from about 6 months old, but developmentally they can be ready from about 4 months old. So if you've got a 4-month-old baby who's really struggling and vomiting a lot, they could be weaned early. But the difficulty is with a 4-month-old baby, they don't have the sort of the postural control, the muscle coordination and the strength that babies would usually have when you start feeding them solids. So what happens is when you start trying to feed them solids, they're kind of like these sort of slumpy things in a chair, and they really struggle with it. And actually what that can end up with is, because they struggle and they haven't got the skills in their mouth or in their body to be able to cope and manage with a slightly more solid food, they end up with quite a significant gag reflex. Now, what happens when you gag? If you ever catch your gag reflex, if you're brushing your teeth and you hit your gag reflex, what's one of the first things it makes you do? It makes you sick. Yeah. Absolutely. So you've then got this vicious circle. So you've got a child who then has this oversensitive gag reflex, which makes them more sick. But being sick was the problem in the first place. So therefore, what you then start to see is children, they sort of don't want to take in that intake. And so they're not maybe drinking enough, or they're eating only sort of, a limited amount of things. And so actually what then happens is, well, first of all, maybe they're hungry. So they're waking up a lot during the night. And so you get very, very sleepless parents, and you get very, very fractious babies who are waking up. When I say babies, you can be talking about this going on from young 4, 5, 6, 7, 8, 9-month-old. So it can go on for, many months, waking up, because actually they're hungry, but then they will only take a very, very, very small amount, because if they take too much, it's going to make them sick. So they'll take a tiny amount of food, and then that'll be just enough to take the edge off their hunger. And then I'm not having any more, it'll make me sick. So, but then of course, an hour later, they're hungry again. So they're awake again. So you get sleepless babies, you get sleepless parents, exhausted parents.
Yeah, the same sounds exhausting.
It's exhausting. And the other thing, you often then begin to get other problems like constipation. So babies that obviously aren't drinking enough, aren't eating enough, or are restricting what they're eating. And young toddlers as well, they then get very constipated. Now, of course, if you're constipated, the first thing you do is go off your food, and you don't want to eat because you've got tummy ache. But also you learn that when I eat something, it gives me tummy ache. So that's another reason why I'm going to avoid this food and drink thing, because it gives me tummy ache, and it makes me either sick or it gives me tummy ache. So, you can see you get this real vicious cycle where babies kind of learn that, and young children learn that eating can be quite a painful and difficult experience. And that is tagged in the brain, therefore, as something to kind of avoid doing unless it's really necessary, which sounds really quite extreme. But actually, if it's hurting you, eating is not the body's main priority. Breathing is the body's first priority. And after breathing, avoiding pain comes next. So eating and drinking, kind of meeting your energy requirements, kind of comes even further down the pecking order, as it were. So children will begin to avoid to do it, and it gets really difficult. And that has such a massive impact on, obviously, the developing baby, their developing skills. And as they get older and start to learn to try and eat new foods, it has a huge impact on that. But it has a huge impact on the whole family, really, because it makes it very, very difficult when they try and go to social events, if they want to leave their child with a babysitter, if they want to go to a family party. If you've got a baby or, a toddler who's got really struggling with these issues with learning to eat, and they've got lots of vomiting or lots of constipation, you start avoiding going to these events yourself, and your own social circle and your own social network and your support therefore gets smaller and smaller and smaller and smaller. So it's what starts off as a bit of reflux can actually, for some children, become a really significant issue.
Yeah, for them and their families by the same.
Yeah, absolutely.
So you've talked quite a bit about sort of reflux there, particularly how it starts, how it kind of, can kind of snowball in a way. What's the difference between reflux in children and adults, do you think?
I think probably from what we see at our feeding clinic, the main difference is with adults. A lot of adults will get sort of silent reflux, so you'll get that burning sensation in your chest, and you'll know, but you're not actually physically sick a lot of the time. Babies and young children do tend to be. You'll see it. They are physically sick a lot more, and as I've already said, they often have the reflux. One of the side effects almost of the reflux is you sometimes get an oversensitive gag reflex, and that oversensitive gag reflex then ends up, when you're trying to give children new and different foods, or put solid foods in their mouth, or put a spoon in their mouth, it causes them to gag, which of course causes them to vomit. So quite quickly, it can have quite a significant impact on their nutritional intake, because babies and young children will learn to limit what they eat to a few what we would call almost like safe foods, which are kind of, these are okay. I know I can have these. I know they don't make me sick, and they don't give me too much tummy ache, so I'm just going to eat that. But the trouble is that often gets smaller and smaller and smaller, and it's very often limited in terms of textures. So quite often sort of smooth textures, or might be the thing, or they might just have one or two different sorts of foods that they eat. So you do get nutritionally, you can get quite significant consequences quite early on. But again, it's difficult for, sometimes it's not really taken seriously by medical professionals, by GPs, because often from a calorie intake point of view, these children are still able to meet their calorie requirements. So, for example, if you're only eating, strawberry fromage frais, well, full fat strawberry fromage frais is absolutely full of sugar and fat. So from an energy point of view, if you're eating loads of those, you're still getting lots of energy, so you're still growing, and it looks fine from the outside. But the fact that that's all you're eating, you can't eat anything else, actually, that's a real big problem going forward, isn't it? But you can't see that problem on the outside as such.
And presumably as well, that we're talking about quite young children, and that it's, where it starts, and, being able to communicate what their symptoms are. As adults, we can do that, and we can go and see a GP, and we can talk through, what are symptoms of reflux. Even if we don't realise they're all related to reflux, we can at least express that to a GP. But
yeah, absolutely. And even with older children, we do still see with older children they'll get direct sort of discomfort from from it, or they've got a memory of really strong. It might not be a conscious memory, but they'll have almost, like I said, tagged in their brain that food or drink causes them pain, and so it's tagged as a warning thing to avoid. But even in older children, understanding that and being able to verbalise that is really, it's hard to understand as an adult, but as a child, trying to verbalise it is really tricky. Trying to explain it to someone is really tricky. And a lot of our children are neurodiverse. So a lot of our children, like I said, we have lots of autistic children, or children with Down syndrome or cerebral palsy, where communication difficulties is a significant part of their overall diagnosis anyway. So, we have to kind of work out through how they're presenting what might be the problem. So when we're looking at sort of the treatment for children versus adults, if you're looking at adults, it's medication probably is the first line of events, and then they've got some surgery, and then there's neuromuscular training that we know about as well. With children, we work really closely with dietitians, because the dietitians often will have to kind of look at their diet really, really closely and try and eliminate and work out what's going on, or are there any maybe intolerances or things that are maybe sort of aggravating the reflux. So we work really, really closely with dietitians in a kind of a process of elimination and trying to work out. And there's, the medications are available as well for the children and babies as well. But again, they can't tell us if they're working or not. It's very, very much a guessing game.
And is there medication for children that aimed at?
Not specifically, no, and not specifically. So, unless you look right at sort of young babies, that you can put sort of thickeners like Carabel into the milk that kind of thickens it up and makes it a bit heavier so it stays down. But in terms of actually when they get older and weaning, it's just a smaller dose of the the medications for adults, really. So, we don't, it's tricky, isn't it? It's like a lot of medications that are given to children there.
And what about the other things that you mentioned for adults, things like the neuromuscular training?
The neuromuscular training is absolutely. So we do use neuromuscular training actually with some of our older children for the treatment of reflux. So if they are still actively symptomatic when they come to us, when they're a bit older, and they are able to engage in that training with us, we will certainly use that with them, effectively. But again, a lot of our, the younger babies, you can't use it with the younger babies. And as I already said, some of our children are neurodiverse children. Or children who are very, very sensory sensitive, trying to put something in their mouth. They don't understand, and they're kind of like, oh, get away from me. So it can be quite difficult to sort of do that active hands-on. And another challenge we have, of course, is because some of our children are so, oh, goodness me, they're so fearful of new foods really making them sick, they won't take medication because it's different. So they will literally refuse to take medication. So whereas with an adult, you can sort of say, look, I know this tastes disgusting, this, medication, but it's for your reflux and it'll make your heartburn better, et cetera, et cetera. You can't have that conversation with a younger child who won't understand, and they'll refuse to have it. So it's a complex issue.
Sounds very complex. Sounds probably like we wouldn't even begin to think what it can be like for these, babies, and children and families. And reflux, is so not greatly understood in adults. It sounds like it really isn't terribly well understood in children.
No, I don't think it is.
And so what do you as a feeding trust, how do you help those that are referred to you?
So I think, as I said, our starting point really is our dietitian will do a really, really thorough sort of baseline diet. So they'll really look at the diet over, say, like 5 days to a week, and we will track symptoms, we will track intake, we will have really good analysis of what's going on. And that will allow us to see if there are any active symptoms, and if there are active symptoms, if there's anything in particular, are there any patterns we can spot, either with relation to foods and that might be be it dairy or something like that, or it might be texture of food, or all sorts of different things like that.
So you're trying to look at the kind of picture in the round with these children, because it is.
We have to look very, very much, but also we have to look at the child in terms of their physical activity and things. Again, whereas adults, we eat and we sit still while we're eating, don't we, generally speaking?
Yeah, through necessity.
And then quite often we'll stay, sat still afterwards, whereas children are much more active beings, and a lot of our children are up, down, up, down, up, down, up, down the whole time. Very, very, very active children, or sometimes we've got children with very, very low postural control. They've got, muscle control difficulties. So, of course, that esophageal reflux sphincter that would usually be keeping that stomach nice and closed can be quite lax and loose. And actually, so we have to do quite work on the whole sort of body, the posture, and really kind of get everything a bit more kind of, right, I'm awake, I'm alert, I'm ready to kind of eat and do something. So we really do work on not just sort of the, what's going in. We work on the environment as well, and helping parents with all the coping mechanisms as well, because we sort of said about the fact that children with pediatric feeding disorders, it can be really hard. It can be really tricky because they can become very, very aversive, and they can be really kind of, I'd say, almost like fearful towards new food, and they will literally run away, not come to the table, refuse to do anything. So kind of coping with how do we manage all of that? So we have to look at all of that, and we have to look at all the related developmental things that might be going on. As we've said, if you've got a child who's having communication difficulties, etc. So we have to look at the whole child, basically, within the context of their family, within the context of their community. It's not just about treating the reflux as a single issue on its own. It's very much a holistic package. So
where can parents go if they're concerned? Where could you signpost them to?
So I think, first point of call is always your GP, in terms of, it's definitely always worth trying some of your standard sort of anti-reflux medication first of all. But if you're finding that you're really, really concerned about your child's sort of dietary intake and their ability to eat, and they've really got some significant feeding difficulties, there is a lack of awareness of paediatric feeding disorders, unfortunately, and a lack of awareness of reflux and the impact it can have. But certainly here at the Feeding Trust, I say we're an organisation that aims to support the whole sort of family. So we've got some advice and some signposting. They could come to us on our website. We've got some resources for parents on there that talk about, as I said, looking at the whole child within the context of their family and looking at all these issues and helping parents maybe to kind of unpick some of the complex issues that might be going on, that might be contributing, and helping them to look at those issues and giving them some really good tips and tricks and sort of strategies that might help support them.
That sounds, fantastic, fantastic advice. Of course, your GP is the place to go and start having the conversation, with your child and keep the conversation going, to be able to kind of turn to a website like yours and try and access some extra information that might just help people sort of find their way through, have conversations with other professionals, etc., will be, I'm sure, really, really helpful for people to go and be able to have a look at. And the whole purpose, that today, and being able to talk to you, trying to raise awareness, people's awareness of reflux in adults and in children, so that we start to let people know there is something that can be done, to try and help people get a much better quality of life and not let reflux kind of take over, their whole sort of ability to enjoy food and enjoy.
Absolutely. Because it really does. It's that our tagline at the Feeding Trust is making meal times good times. Because actually that's what you want. You want to be able to enjoy your food, and you want to be able to enjoy eating as a family or eating socially, going out to the pub and having something to eat, going to Pizza Hut, McDonald's even, and if you've got really severe reflux as an adult or child, that's not fun. It's not got the same fun, enjoyable element as it has for everyone else out there who can just go off and eat what they like. So it's really important.
It's been fantastic to talk to you and have your insights, around, the effects on children. And I'm sure everyone would join me in thank you for coming along today. So thanks, Natalie.
Well, thanks, Angie, for having me.
See you soon.
And goodbye, everyone. Thank you very much for listening.